According to the CDC, men in the United States are less likely to visit their physicians than women and more likely to develop chronic diseases. According to a study by the Cleveland Clinic, only about 60% of men go to the doctor for a yearly physical, and 40% won't go until something is seriously wrong. As we recognize Men's Health Month, Dr. Scot Ackerman is joining us for our Talking Health segment. Good morning. Thanks for being with us.
Thanks, Jen.
Oh, these men in our lives, right? Would you explain the consequences? And there can be some dangerous consequences in missing these yearlies or just regular checkups, particularly if you have family history.
Well, and not just cancer, but other diseases as well. And so, we recommend that men see their physician on a regular basis, an annual basis, their physician or their PA or nurse practitioner or whatever provider that they're seeing regularly, because not only can cancers be diagnosed early with screenings, which I talk about a lot, but there's other things that we can look for. We look for things like hypertension or high levels of cholesterol that lead to heart disease. And if these are identified early, you can nip that in the bud and prevent early death from heart attacks or early death from heart failure, things like that. Also, we can do screenings for diabetes and look at the patient's sugar level. And diabetes is a terrible disease if it is unchecked. When you have diabetes, it affects your vision, and you can have vision loss. You can get ulcers in your legs and all sorts of terrible things. Kidney failure, all related to diabetes. And these are all preventable. These aren't necessarily preventable diseases, but we can minimize them and prevent the sequelae of those diseases. These diseases cause other problems. Hypertension, okay, big deal, but that hypertension is going to lead to heart failure, heart attack, and we can prevent that by intervening early in these diseases.
Yeah, and I think that people in general, and men just as bad as women, well, I feel fine, so I don't need to go to the doctor. But you don't know, you don't know what's going on under the skin, so to speak. So what are some of the exams or tests that they really need to make sure that they have every year?
Okay, so for men, we want to do the general health screenings. Like I mentioned earlier, make sure that beginning in their 20s, they get their cholesterol checked on a fairly regular basis, because hypercholesterolemia, which is elevated levels of cholesterol, frequently are genetic, and they could be, onset of that could be identified in someone in their 20s, and so that's a good thing to check early, and you can nip that in the bud. Their blood pressure, to look for hypertension, that should be checked annually, generally over the age of 40. And diabetes, which I mentioned earlier as well. Diabetes, if gone unchecked, can lead to kidney failure and vision issues and problems with wound healing. And we generally recommend checking that, I guess, around the age of 35.
What kinds of cancers do you see most often affecting men?
So the top three most common cancers in men are colorectal cancer, lung cancer, and prostate cancer. Not necessarily in that order, it's actually prostate, lung, and colorectal, with lung being the #1 cause of cancer death in men. Men get other cancers as well. We talk about head and neck cancer a lot and things like that. And these three cancers, prostate, lung, and colorectal cancer, can be screened.
Yeah.
And if there's, and the screenings for them in some cases can prevent cancers, but also mainly we do screenings to diagnose cancers early, but in some situations actually prevent cancers. So for instance, the colorectal cancer, we recommend that men and women begin having an annual colonoscopy. And we used to recommend that at age 50. Now we dropped that down to age 40 because we see an increased number of young people with colorectal cancer. And colonoscopy, done every 10 years, in someone who's low risk, can identify polyps early. And if those polyps, they're not cancer, but those polyps, if left unchecked, will grow and become cancerous. So if those polyps are identified early and removed, that actually prevents cancer. And needless to say, a colonoscopy could identify an early cancer, which would be a highly curable.
And when it comes to prostate cancer, of course, making sure that you're going and you're getting your PSA test, which then can test for that as well to give you some precursors as to whether or not that could become an issue, is important as well.
Right, at age 50 for most men, but if men are at high risk, age 45 are extremely high risk, meaning they have a first-degree relative with prostate cancer, or maybe if they're African American, we should start the PSA test annually at age 40.
Your last piece of advice to the man who's watching here this morning, who's like, I feel fine, I don't need to be checked, I'll do it next year, I'll put it off. Your message to him.
My message is that 40% of men don't go to the physician until there's a serious problem. Don't be that guy. see your physician on a regular basis, get these screenings done for overall health and for cancer, and live a long life and stay healthy.
Yeah, no one loves the colonoscopy and the prep, but come on, get over it, right? Just got to get over it. We all have to go through it. All right, thank you, Doc, for being here. We appreciate you.